Yes, that is very important because the central vein sign, that is only that one vein is crossing through the lesion, through the white matter lesion, and that is very important because there will be now in the new McDonald criteria that will be a sign to decide if a patient has a multiple sclerosis or not. So that when a patient has more than 6 lesions with the central vein, it means that it's very probably that this patient has a multiple sclerosis. The other way is when a patient has many different white lesions in the brain, and 40% of these lesions, they have this central vein sign, it means this patient has a big probability to have MS. So that the central vein sign, there will be a way to have a better diagnosis for the multiple sclerosis. And in our work, we present patients that they have, we don't know the diagnosis. We look at the central vein sign, and when they have less than 40%, they have no MS, and in our case, they have MOGAD or they have NMO, or perhaps only headache. And when the patients they have more than 40, normally the most of them they have MS. That is important because more and more patients they go to the private hospitals or private practice, and they have headache or dizziness, and they have an MRI of the head, and later they have some lesions, and the people they say, okay, you have an MS. But now with this central vein sign, we can differentiate between headache and MS. Only we are looking at these lesions. And when you have more than 40% of this lesion with the central vein sign, or you have more than 6, you will have an MS, otherwise you have no MS. They will be in the New York criteria, and it's very important because when you have a patient that you don't know the diagnosis, and you have more than 40% of the lesions with the central vein sign, the probability to have MS is more than 90%. So that we use the central vein sign in the clinical practice for the differential diagnosis between MS, NMO and MOGAD, and between MS and headache.